The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. Today, our guest is Dr. Marc Nelson, a chiropractor.
Dr. Nelson has spent much of his life researching and learning about how the body functions and how to optimize human performance. Dr. Nelson graduated with honors magna cum laude as one of the top in his class from Logan College of Chiropractic in St. Louis, Missouri. He has received extensive postgraduate education and training on neurology, care of pregnant mothers before and after delivery, as well as chiropractic care for children. Dr. Nelson is a BYU alumni athlete where he competed on the 2007 Mountain West Championship swim and dive team. He also practiced as a certified athletic trainer for Lone Peak High School during their run to the men's basketball national championship. These experiences taught him what it takes to help the human body perform at its optimal level. Dr. Nelson understands that every person is different, which is why he has received advanced training in multiple techniques, including the most advanced techniques in chiropractic that involve no twisting, popping, or cracking. Welcome, Marc.
Thank you.
We're so excited to have you on the show and to talk all about how chiropractic care can help us in pregnancy.
Yeah.
Will you tell us how you got into being a chiropractor?
I was an athletic trainer, and that's really where it started, is going to school as an athletic trainer at BYU. And as I worked with athletes specifically, I found that athletes that stayed with us and did more conservative treatment ended up getting better and actually performing better after an injury, right? As opposed to when we would send them to, let's say, like a orthopedic surgeon or something like that, that would generally do injections or anything else like that. I saw multiple athletes lose their ability to go onto like a professional sport, right? Completely lost it because of the side effects that came along with the stuff that they were getting. So I kind of just developed this philosophy in my own mind based off of my observation that the body will heal itself if given time and opportunity. Then I ended up in a chiropractor's office and found out that that's what the whole profession is based on, is that one concept that your body will heal itself if given time and opportunity. On top of that, to be like pregnancy specific, that started when I was in school. So my very first semester of school, my wife was pregnant with our first son. And she was a teacher at the time with such bad sciatica that she couldn't stand for like more than 30 minutes. And so I took her into one of my teachers and I was like, I don't know anything at this point. I'm a semester into this. Can you work on my wife and show me everything that you do as you do it? And so for the entire course of her pregnancy, I learned and absorbed everything that this teacher could have. And I saw just such a huge benefit and such a need for something like that for pregnant women specifically that can't, there's like, what are the options really, right? To give them options to be okay and to make what is should be a beautiful process, at least a somewhat comfortable process too.
There's so many changes in pregnancy and oftentimes also pain.
Yeah.
So it's so great to know that you can actually relieve most of that through proper alignment and through different techniques.
Yeah. I think that that's the most important thing, is to know that there's at least options for you, that you're not, the number of times I've heard women say that they went to their OB and they're like, hey, my back hurts. And the OB goes, welcome to pregnancy. And it's like, no, that's not what this is. Like, this is a normal, natural process and we can help you through it, you know?
Was your wife then able to stand for longer periods as she was treated? And
Yeah.
what did that look like?
Yeah, so about a week into her therapy with my teacher, she was completely sciatica free, and was so for the rest of the pregnancy.
Wow.
Yeah.
So interesting. So how can chiropractic benefit you, not just physically, but also emotionally then, as we talk about pain?
Yeah, absolutely. I think when you think of, number one, think of what you go through when you are pregnant, right? I mean, I am a guy, so obviously it comes from a different perspective, but I've watched my wife go through it 4 times now. And it's a huge mental strain to go through this whole process. Your body's completely changed. You're exhausted all the time, and that's an unusual thing, right? if you're feeling sick, morning sickness, all those kinds of things, everything that comes along with that pregnancy is a huge mental strain. And you never really feel capable of what you used to be able to do. Right. And all of the responsibilities that you carry, even like in my wife's situation, having 3 other kids that she had to take care of while also being exhausted, you know?
Mm.
So that's a huge mental strain. But then you add on top of that something that is physically bothering you, like sciatica, that she was kind of the breadwinner for me at the time that I was in school. We were doing that. And she couldn't provide anymore, right? Or in her case now with 3 kids, can she still provide for her kids the way that she needs to? And back pain, sciatica, pubic pain, all these things that happen a lot during pregnancy only add to that weight,
Mm.
right? So anything that we can do to help a mom to remove that physical stress makes the mental stress significantly easier to deal with.
Hmm.
So that's something that we try a lot in my practice to focus on education and helping people know what they can do. Because the more that they know, the better choices they'll make, and then the better outcomes they'll have. And the more that they know, then kind of it relieves a lot of that mental weight that comes along with it as well, right? Knowing that it's a natural process, knowing that things are okay.
Well, and this domino effect is so important to remember. If we're having pain that is prohibiting us from enjoying our day to day or from picking up our children or doing the daily tasks of life, we're going to have such a harder time emotionally and mentally,
Yeah.
like facing the other trials that are thrown at us.
Yeah, 100%. And I kind of refer to something that I call the cascade effect, which is like when water starts falling off of a waterfall, it's like a small thing, but then as it falls, it grows and and it expands, right? Like that kind of cascade where one thing happens and then 2 things happens and it grows and grows. That's exactly what that is. Low back pain during pregnancy is a small thing that will cascade into a massive thing because of how it affects everything else.
Yeah. So, in your practice, are you giving women specific exercises to do at home that are helping them, or are they just coming in more often to find that relief through chiropractic care?
Yeah, it's a mixture of both. Like when someone comes into our office, we're going to do a really thorough evaluation because we need to figure it out. But we have a specific set of exercises. Even on my website now, I have a series of exercise videos that anyone can access that shows you how to do specific things. Like good example, I just had someone this morning that has diastasis recti. So she just had her baby, and now we're going to be working through postpartum care to reverse the diastasis recti without having to do anything more like interventional, right? We can do this naturally and we can close it up. I think she's 1 week postpartum at this point, and we like to be a little aggressive with our treatment. So we've already started her on exercises. Um, Very simple ones that help her build up to that 6 week mark, right? When the OB would say, oh, 6 weeks, good to go, no restrictions. It doesn't work that way because you didn't do anything for 6 weeks, right? So we want to build up and be really progressive with that. But then if I can catch them early enough, meaning 20 weeks and before, we can stop those from ever even becoming an issue through exercises, through adjustments, through whatever we need to based off of what their particular situation is.
Hmm. This is incredible. I feel like prevention goes such a long way and just education. I know for me, I learned a little bit later that all of these things were happening. I have diastasis recti and have been working on that, but it's been a slower process and the longer process. When I found out about it, if I had had these tools sooner to start earlier, that could have been amazing. But for those people that do find themselves in those conditions of diastasis recti, how does chiropractic compare to pelvic floor therapy
Mhm.
or other health providers that could work with that?
I think the important part is that we can't separate them as anything as like individual or distinct. That pelvic floor therapy works better when it's coupled with chiropractic care or works better when it's coupled with massage therapy or whatever else.
Mm.
It just expands your abilities. When it comes specifically to something like pelvic floor, as an example, because it's such a prevalent problem after delivery, the research has shown that just simply mobilizing or adjusting the pelvis activates the pelvic floor. So if you are in prenatal, it's going to give you better control over the muscles of the pelvic floor, which can actually speed up the process of delivery itself, specifically the first 2 phases of delivery. Um, Afterwards, it can help you avoid things like urinary incontinence, or diastasis recti, or all these other pelvic floor issues that come up. And that's kind of when you combine the two together, when you have something where you're doing exercises specific to the pelvic floor and then adjusting it, which increases the neurological activity of the pelvic floor, they work hand in hand and become significantly more effective.
I think all of our listeners are going to be signing up and coming for that preventative care, especially if it can speed up the first stages of labor. Can you tell us a little bit more about that?
My senior thesis that I did for chiropractic school was all about pelvic floor dysfunction and chiropractic care. Concept behind it is that if you have a better control over your pelvic floor, you will have a better ability to push, and that also it increases the first couple phases of actual labor itself, making it just an easier process. So what we found through a lot of the research is that you can actually decrease labor time and you can decrease labor pain, somewhere up to 60% in some cases, based off of the research that they've done.
And that's just learning how to relax those muscles and kind of like get them out of the way for then baby to descend?
In most cases, more often than not, a pelvic floor dysfunction is actually over tone or over tight muscles in the pelvic floor. So if you think of it, like if you have urinary incontinence and you sneeze and you get a little bit of leakage, essentially what's happened is the pelvic floor is really, really, really tight. And then you sneeze and it's like, I got nothing left. And it just fails, right? That's more common than having a weak pelvic floor. So there's a big controversy now, for example, Kegels. I'm sure everybody's heard about Kegel exercises. There's a big controversy as to whether or not we should do them. I believe we should, but really specifically in specific cases. And you have to know how to do it correctly. Otherwise, you're just going to be taking a hypertone muscle and overusing it some more, and then it's going to fail more.
Are Kegels something that we should avoid the last few weeks before labor?
It really depends on the situation. Yeah, but being able to have control over the pelvic floor, I think, is vital, right? And leading up into, let's say, the last 2 weeks before delivery, it's very important that you're able to actively and mentally control that pelvic floor, which will speed up your process of delivery while not allowing it to be overdone and cause problems. Right.
This is a fascinating conversation. With my first, they said my pelvis was too small and they used the vacuum twice, and then I was moved to a C-section. I am now learning that that could have been some of the contributing factors. I have gone in for massages and they always say my muscles are tight, and I've been receiving acupuncture and pelvic floor therapy to help relax some of these muscles. But what would you say in the case of a pelvis? Is it positioning? I know there's a lot of factors and answers, but how could aligning a pelvis help more with delivery?
Yeah, absolutely. So I think one of the greatest examples, I actually thought I was going to bring a spine and I completely forgot, so I apologize for that. But if I can use my hand, so this is the shape of your sacrum. Okay, your sacrum sits in between your two sides of the pelvis, right? The sacrum, when you actually deliver, should do what's called a nutate and counter nutate. Essentially, that means that it should bend this way as the baby drops into the pelvis, and then bend back the other way as the baby actually exits.
Mm-hmm.
The problem that we run into a lot is that relaxin hormone releases your tendons, ligaments, makes everything just move around a lot, right? And so oftentimes we'll find that pelvis shifts like this and then jams that sacrum and makes it incapable of doing its proper movement. So that can delay the process of actually initiating delivery because it's not rotating backwards for the baby to drop. And then it can also delay the whole process of delivery itself because it's not rotating back the other way so the baby can actually exit. So in this particular case, if we're talking about just pelvic floor, multifactorial, I mean, there's so many different things, but If we're talking about just the positioning of the pelvis as a chiropractor, I'm working on making sure that that pelvis is aligned so that that sacrum is capable of moving freely. And then ultimately, the relaxin hormone is supposed to release those ligaments to allow your pelvis to separate as you actually give birth. It's not necessarily a case of your pelvis is too small, or it would be more towards your pelvis is not functionally doing what it's supposed to.
Mm.
Does that make sense?
Yeah, it does. And where is the relation to your tailbone with all of that? I feel like I may have had an undiagnosed tailbone injury when I was
Mhm.
younger, so I'm wondering if that played into it too.
Yeah, absolutely. Because so at the bottom of the sacrum, if this is the sacrum, the tailbone sits right at the bottom
Mhm.
and oftentimes can cause issues with delivery, but it should move with the sacrum itself.
Okay.
The problem would be is if you've had a previous injury to your tailbone, you probably got a lot of scar tissue and buildup and things there as well. So that would also prevent it from moving freely.
Okay.
I've had a couple cases, women coming in postpartum care that actually fractured the tailbone during delivery, which I mean, that's obviously just adding on top of what's already a difficult process.
Right. So tell us a little bit about our positioning in labor then. If we need to allow that pelvis and that sacrum to go up and then go back,
Mhm.
are there certain positions we should try to avoid or to
Yeah,
get into?
the one that they put you in is the one that you should avoid.
On your
On
back.
your back, feet up, like that is it's pretty well understood that that's like the worst position that you could be in for pregnancy. I believe the most preferred position that I would recommend as a chiropractor is actually a squatting position. And that's really beneficial for two reasons. Number one is it increases the mobility of the sacrum and the pelvis, but you also have gravity working on your side to actually push the baby out. So that's probably the best position. But honestly, when it comes down to it, outside of laying on your back on your sacrum where it's not really capable of moving, all other positions are good.
If you have the epidural and you are kind of in the bed, would it be helpful to lay on your side, or is it best to then try to get them to drop that bed so that you're able to be more in a squatting position?
Right. So in that particular case, let's say you don't have like a walking epidural, right? Or the ability to get up and move around. I would say that most of the laboring can be done on the side, which would be a little bit easier position. You could pull the chest or your knees up to the chest, right? And at some point, if you're not capable of standing or moving, you're going to need to go on your back. You're kind of forced in that position. It is the most effective, at least from the OB standpoint, to be able to kind of do their job. It's just not the best position to
So
be able to labor.
can you create the squat position then if you're on your back or your side by bringing your legs and your knees all the way up?
Yeah, potentially. Yeah, like I said, if you're kind of on your side, more in a fetal position, that could help as well.
Hmm.
Yeah. But ultimately, again, just for the obese purposes, you're probably going to end up on your back, and that's okay. It's not a great position, but it's something that we can deal with.
Yeah, you'll hear a lot of people saying like, I pushed for so many hours, I was pushing for so many hours, and you wonder if the positioning could affect the pushing stage.
Yeah, absolutely. Yeah. And I mean, my preference is that people are standing most of the time, right? Standing, squatting, or like in a moving kind of position. And the reason for that is again because we want mobility out of the pelvis and out of the sacrum. And so all of those things do help with the whole labor process. And if at the very end, right when you push, you're on your back, then that's probably fine. But at least you got to that point and progressed everything quickly and smoothly because you were in a different position.
Hmm. I remember nurses encouraging me to move or to walk or to, you know, engage labor different ways. And for me, it was just more like, oh, well, this is my preference. I'm going to lay in the bed. But I didn't really understand that that is beneficial to labor and the baby. And sometimes just lack of knowledge, you just don't understand what is going on.
Yeah. I would say like what's the most common thing that people tell you? Like if you're trying to induce labor, right? If you've gone over your due date, what do they tell you?
Curb walking?
Go on a walk, right? Curb walking or go bounce on a exercise ball or something. Like it initiates pregnancy and can be very effective in keeping your pregnancy progressing until the moment that you need to actually push, which should be relatively short, hopefully, if everything is in the right place.
Let's move on a little bit to position of baby and these babies that are sunny side up or in different positions that are conducive for labor.
Yeah, so that's what Webster technique specifically is most famous for, is actually helping aid flip a baby of breech. So the important part is that it is not a treatment for a breech baby because we don't do anything to the baby. We're not flipping anything. We're not doing any of that. But the natural position of the baby should be head down. That is its most comfortable position, and it's where it wants to be, right? It wants to be in that comfortable position. So what we find is a baby in a breech position is typically there for a reason. Okay. So whether or not that would be because mom's pelvis has shifted and rotated and it just doesn't have a whole lot of space, the most comfortable position it can find is going to be head up, right? That's where we have the most success in being able to actually flip a baby, which is super cool to see. I've had multiple moms. We've probably just in the last year had like 6 or 7 moms that came in at 38 weeks and said, my baby's full breech. And we said, we'll do what we can. 2 weeks later, baby's head down and they delivered normally without any issues, which is really, really cool to see. But the concept is to remove as much tension from the baby as possible that allows them to position themselves in a comfortable position. And I always tell my moms that there's really 3 outcomes, right? The first one is baby flips, usually, takes a handful of visits and baby's head down and it's awesome. Second outcome is that external inversion just becomes easier, which I don't know if either of you have had external inversion. Yeah, it's not a comfortable thing, right? It's a very painful thing from all the moms that have referred to it, but it can make it more effective because their pelvis is now in a much better position, much better alignment to make that flip occur. The third thing is that the baby just doesn't flip. And the reason the baby doesn't flip is because there is something that would put it in danger, right? So the issue that we run into with external inversion is that if I force the baby to turn and the cord is wrapped around the neck or there's something else going on, then it's an emergency delivery or C-section at that moment, right? Compared to what I do with the Webster technique, the baby will not put itself in a dangerous position, right? So if it doesn't flip, then there was a really specific reason as to why. And it's going to stay breech because of that particular thing. But if it's not in a dangerous position, it will flip itself because it's in much better positioning.
Both of my first pregnancies, my first son was sunny side up or posterior, and his labor resulted in a C-section after about 40 hours of trying. And so with our second son, I really was, like fearing posterior. Oh, please do not tell me he's OP. And after about 24 hours of labor, we were thinking, all right, something's going on. They did another check and he was OP. So they said, do you have a chiropractor you could go to? I was delivering at a birth center, so I didn't have any issues with being checked in already. And we called my chiropractor. He said, I've got something in about 2 hours. And so we made the appointment. My husband and my doula, who was training to become a midwife, took me there. And so I was in active labor. Contractions were 3 minutes apart. And so I just went in and he would work on me. And then I would stand while I was having that contraction so I could kind of move and sway and slow dance. And after a few minutes of doing the adjustment, of doing the massage and trying to open up that pelvis, they thought, okay, you look like you're in a better position. My doula could tell that my baby had actually looked lower in my abdomen. And so we went back to the birth center and they found that he had rotated.
Yeah.
So I'm so grateful for chiropractors myself because I feel like they enabled me to have that VAC, to have the vaginal delivery. Yes. For my third son, I don't think we ever had an issue with his positioning because my labor was very quick and very, smooth delivery there. But it's amazing that a chiropractor can use their skills, their knowledge to kind of help that baby get in the correct position.
Yeah, it's super fun. Actually, one of my patients, she also does a podcast, but it's specific about VBACs because she had 2 C-sections and went for a VBAC after 2. Which is obviously not very common. But so we worked with her through her entire 3rd pregnancy, and she was able to successfully have a VBAC after 2, and then subsequently went on to have another VBAC for her 4th child, which it's just so cool to be able to see that, it changes a lot.
Yeah, the work that you're doing is changing lives. It's changing our abilities to deliver, and that's awesome.
Would you want to share any of your wife's experiences with her labors or how you were beneficial in being there as a chiropractor on hand?
Yeah, I mean, this is gonna sound odd, but my wife has had 4 C-sections, but for very different reasons. The Our first son was actually born at 30 weeks, and he was born at 30 weeks because my wife's body just filled the placenta with blood clots. So I was in chiropractic school, and we went to a general review of the baby, and they did the ultrasound, and the OB walks in and said, "Okay, you could drive to the hospital, or I will send you in an ambulance." And I was like, I mean, I don't know what you're talking about right now. So just like 0 to 60, we ended up in the hospital for, I think, about a week and a half before the baby's decelerations were happening so frequent that we had to deliver. He just didn't have any amniotic fluid. So that turned into a C-section. Our second one, same thing. She went preeclamptic by around 34 weeks. And so he was delivered at 34. So I had a 30 and 34. The third and fourth kids, due to the fact that we had had 2 C-sections and everything else, all the complications that we had, we were able to actually carry to full term. Mainly based off the fact that there's been a lot of research, which has been cool. So this is something that might be interesting to everyone on this podcast. If you deal with preeclampsia, there's a lot of research that has currently gone into baby aspirin and low dose baby aspirin from the moment of inception to delivery has been extremely effective at decreasing the incidence of preeclampsia. For my wife specifically, our second son, we did the low dose aspirin and we carried him to 34. We still went preeclamptic and everything. So our third and fourth, she did a double dose of low aspirin and carried to full term. Yeah.
That's interesting. I've had 3 C-sections as well. On this podcast, we're trying to help women find their best birth, whether it is, C-section, vaginal, or a myriad of other, interventions or outcomes.
What's so interesting about it that I deal a lot with this in my practice, being like specialized in prenatal. We all have an idea of what that best birth would look like, and we should trust our bodies to be able to do that, right? So we talk a lot about just trust the process because you were made to do this, and it is a natural, normal process that should occur, and you should be okay to do it, right? Actually, just as a side note, the number of times that I've seen women that came in that did like an unmedicated birth, I think that's really cool because of their reaction to it. Because it's like running a marathon, right? It's really cool that someone runs a marathon and then you see someone come in and like, I just did unmedicated, and they're like, you see that like brightness in their eyes and they think like, man, you just accomplished something really cool. That's impressive. And you are more than capable of that. I think that women nowadays we're just taught over and over, you're not capable of this. It's going to hurt and you're going to hate it and you're going to instantly go to the epidural and all this other kind of stuff. Just to tell someone's like, no, you are capable of this. You can, in fact, do that. And it's hard, but you're capable of it, right? I think that's really important. But watching my wife go through this is, from a chiropractic perspective, my wife just had 4 C-sections, right? So it kind of seems a little bit odd, right? We should be a little bit more holistic, right? But it doesn't. That's not what it's about, right? I have 4 beautiful kids, and I am unbelievably grateful for what the medical community can do to bring me my son from 30 weeks, right? I'm so grateful for that. And it doesn't matter if the plan didn't work, because it worked to give me my son, right? And so like, I'm grateful for that. And what I wish that I could just help people understand, and what I tried to do in my practice, is number one, trust yourself, trust the process, know that it's natural and that you're capable of it. But also trust the fact that sometimes things just don't go right. And at the end, all of that was worth it, right? Because you now have this beautiful child. So I know we talk about the mental aspect of things too, right? I think if I can help someone understand that, and be better mentally because the process worked, then we're good.
It's so true. There are so many medical advances and science has advanced that we have been able to save so many babies that we wouldn't have otherwise, and mothers. Just we can't, ignore the fact that that is a miracle in itself. I have the blood type where I have to have ROGAM, and
Mhm.
it's like fascinating that our bodies, some bodies used to reject the baby, and so even that is just huge. So I love that point that you bring in that, science can do this. We can do these C-sections, even if it wasn't the ideal outcome or the expected outcome, it's still a good outcome.
Yeah. And even in those cases, having knowledge, like what you guys are doing with this podcast, having a knowledge of what you can still get and what you should still expect out of those situations. Let's say things go wrong and you're now in a C-section and then it's emergency C-section for whatever reason. There's still those beautiful moments where you can specifically request to your doctor, like, I want this. I want skin to skin immediately after C-section, which has become significantly more common. I want to be able to do a more natural process. I want to nurse my baby immediately, all those kinds of things. If you're going in and you want an epidural, asking for a walking epidural so that you do have that ability to stand up and move and make this whole delivery process smoother, right? And the more knowledge you have from this podcast and from what you guys are doing, then you can request those specific things and stand up for what you want,
Yeah.
right? Because I also did deal with so many moms that are like, "Oh yeah, they scheduled an induction," and my first question is, "Why?" And they're like, "It just seemed convenient," which is the worst reason to ever do a scheduled induction, right? You don't do it out of convenience. Your body is not prepared for that yet, right? Which is why inductions typically don't go great. Because your body goes from 0 to 60 in 10 seconds because of what's going on. But if you're more prepared for delivery, if you're going into this kind of more natural process, and you can tell your OB, like, I really don't want to be induced, that's okay. And you can stand up for yourself for that too.
And if you want to be induced, then how can you do it in a way so you're helping your body?
Absolutely. Yes, that's a great question. So I would say that inducing is fine as long as your body is prepared for delivery. So it does need to at least go through some process, right?
Right.
Moms who come into my practice and let's say they're dilated to a 2 or 3 and have been that way for 2 weeks. Awesome. Go get the induction. That is a good time to be able to do this because you're already prepared.
Yeah. And you can ask your doctor to check your Bishop score. So that will tell you if you are kind of on your way to labor.
Yeah, absolutely. And if you're not there yet, then inducing at that point is going to be hard, right? If you're on your way, inducing is going to be pretty easy.
Sometimes we do need those interventions, but it's at what level and at what time.
Yeah,
For sure.
exactly.
Well, we love to share resources on the podcast.
Yeah.
Do you have any favorite books that you'd like to recommend or anything else as a resource for us?
So because I deal with Webster, spinningbabies.com is a fantastic website to go to and follow some of those exercises. That would be one. Anyone can go to my website, which is afcadence.com, and we have an exercise portal on there that you can go through and actually see how to do specific exercises. So anyone can go onto those as well.
Fantastic. I have a quote from a book. I am Malala, and she is a really good advocate for education and just women. And she says, "It is my belief that God sends the solution first and the problem later." So I just love that with chiropractic. You have these solutions, you have this treatment that you can use before even having a baby. We have a Mom Squad secret of the week, and this is from Carla. She says, "Savor the time during your pregnancy. It goes by so fast. Cherish the times you feel the baby move. Look on in amazement as your belly grows." And I think that's such a great reminder because sometimes maybe we don't always look on in amazement, but it is really a process of miracles. And as we remember that, it'll just make the process so much more beautiful.
Yeah, absolutely. Pregnancy is a beautiful process. Doesn't have to be a painful process.
So true.
Thank you so much for being on the podcast today.
Yeah, thank you for having me.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.